I went to the movies once with a girl that I was trying to impress back when I was a teenager. I remember we were getting our food and laughing about the movie we just saw when she said her chest started to hurt. Now, I just thought that she needed some fresh air, but she collapsed. People started gathering around and panic kind of started to break out. And my blood was pumping, but my adrenaline was going. And I actually had no idea what I was supposed to do. Cardiac arrest actually is the leading cause of death worldwide. And knowing CPR can double or even triple somebody's chance of survival. So after becoming CPR certified and studying these processes, I can share those life-saving tips with you. First, I'll explain briefly how to access the scene. Second, I'll explain the proper steps in actually applying CPR. And lastly, I'll explain the different scenarios and variations that you may come across. First thing we should do when arriving to the scene is making sure that the scene is actually safe. There can be dangers present or hindrances that can cause harm to you or the person that you're trying to administer aid to, and can cause the inability to actually even perform those CPR steps, like fires or unsafe flooring, or even having too many people in the actual surrounding area. If someone else is present, tell them to call 911 and find an AED if available. If you're alone, call 911 yourself and put them on speaker so that way you can continue administering aid. Second would be to assess the state of the person in the emergency. You want to check the person's pulse and their breathing and make sure that they're breathing properly. This step should only take no more than 10 seconds since time is of the essence. Third would be to check a response from the individual. Tap on their chest and see if they get any signs of consciousness from them. If unresponsive or not breathing normally, call emergency services immediately and get an AED if available, according to the American Heart Association. Once you have taken these actions, you will then begin administering CPR. To begin administering CPR, you'll first begin with chest compressions. First, you'll place your dominant hand on their chest, at the center of their sternum. You will then overlap your other hand with your dominant hand and interlock the fingers with the hand that's dominant closest to the chest. Be sure to lock out your elbows and be sure to make sure that the hand is placed on the sternum at the heel of your hand. When giving chest compressions, keep a steady rhythmic pace for 100 to 120 compressions per minute, allowing the chest to fully rise after each press. For adults, the depth of compression should be about 2 inches. After 30 compressions, you will give a person rescue breaths. There is equipment available to avoid direct contact with the person if you do not have some on you. But in the event you do not have any equipment for you, follow these procedures. Open the airway using the head tilt chin lift method by slightly tilting the head back and opening the chin up and the mouth open with 2 fingers. You will then give the person 2 full breaths, allowing air to fill up the lungs. You should watch to see their chest visibly rise, and each breath should only last for 1 second. Then you will return the chest compressions for 30 more repetitions. You should continue this process until EMT personnel arrive. The system is made for majority of people, but there are some small instances that call for minor changes. CPR for kids is similar steps, but there are a few differences that are imperative to adhere to. When aiding a child, you should only use 1 hand instead of 2. And depending on the child's size, the compressions should still be at 2 inches, but be wary of smaller frame children. For infants, you'll use 2 fingers instead of 1 hand just below their nipple line. Also for infants, during your rescue breaths, you want to make sure that you are only blowing just for their chest to rise, not full breaths. And lastly, for women in pregnancy, there is one important change. The uterus in late pregnancy can compress major blood vessels and reduce blood flow back to the heart. To fix this, you should actually gently push or tilt the pregnant lady's belly to the left slightly while performing compressions. This is called the uteral left displacement, and it helps improve circulation during CPR. Today, we have covered some vital life-saving steps that will assist you in CPR training should you ever need it. We've covered assessing the situation, calling for help, performing chest compressions and breaths, and what to do when you're aiding pregnant women, children, and infants. Proper CPR training can really save someone's life in any type of scenario, and is imperative to know to improve their chances of survival. So if you ever see someone's life on the line or their life in danger and no one's answering the call, will you be the one to do it? Thank you.